Hello, so this is Dr. Susan Lavelle with Premier Wellness, and you know I've been talking about 30 days of health and hope for the last 15 days. We're halfway through, and today we have Danielle Allen, who is actually a first responder, an Aurora Fire Department firefighter. Yeah, I guess, yeah, that's what you call her. And she wanted to share some things with us, a real PSA kind of thing. And then I have some information for you at the very end. Take it away, Danielle.
Okay, so the PSA is pretty simple. It's just for when to call 911. I think a lot of people in our country don't actually know exactly when to call. The 911 is an emergency system, so that means if you honestly feel like you cannot make it through the night, whether it's you're having significant trouble breathing, significant chest pain, somebody's having a stroke, prolonged seizure. These are the reasons why you should be calling 911. Even broken bones, I would say, would now be kind of categorized into maybe an urgent care. What we're finding is a lot of people are actually putting themselves at more risk by going into the hospital when they don't need to. So we're not trying to talk people out of getting transported to the hospital, but really just making them known, like, hey, the hospital is not the safest place to be right now. This is especially true if you consider yourself immunocompromised and you are having some slight and cold and flu symptoms. The first thing you should do is contact your primary care provider. Talk to them to see what they have to say, and then after that, if they suggest 911, then probably end up calling us. Because what we're finding is we can show up on scene and we'll get all suited up, but realistically, a lot of the people that we're talking to don't have significant enough symptoms for active transport. The hospitals is overloaded. Most hospitals are overloaded and taxed. And so that's just kind of, to say, make sure if you're calling 911, it is a serious emergency.
I mean, it sounds like almost a catch-22 because you don't want to ignore anything. But on the other hand, as you're saying, if people are calling for things that aren't real emergencies or not significant enough emergencies at this point, you're taxing an already strained system from the first responders all the way to the operating rooms if it's getting that far. So I understand what you're saying.
Yeah, that's the primary reason why we do want to flatten the curve. It's because we can only have but so high of a capacity to to um, to function at before we can't serve people.
Exactly. I mean, I've shown that curve before, where you have that exponential rise. And at a certain point in that rise, the system can't take care of it anymore. It just overruns the system with numbers and severity and just disease. So that makes a lot of sense. Thanks. Anything else?
I think that's it. I mean, honestly, stay safe, and actually do the social distancing. That's kind of the other thing. Even when you're going out to the grocery store and going out into public spaces, understand that, I mean, before the coronavirus, these were still places that did carry germs and bacteria, and it's always good to wash your hands. But even now, more so, understanding it's not just washing your hands, it's what are you tracking into your house, what clothes are you wearing. And so that's kind of the decon that a lot of first responders have to do when they come home, is not tracking and taking things into your house.
Yeah, I mean, you think about it, and it's bad enough for us. We're kind of in a controlled environment when we're just going out, but you guys are literally going to places where you don't have control. You're doing the best as you can with your, what did you call them? What kind of suits did you call them?
Zoot suits or Tyvek suits, yeah. We usually have full Tyvek suits, so they look like hazmat suits.
So you've got them, but still, how many times have we seen where something doesn't work or there's a break and it could be something really bad. So I thank you for that. I thank you for sharing that information. And I did want to share one thing with you all. dear listeners and watchers, that Danielle Allen is also my daughter. She is in paramedic training. Yeah. Oh my goodness.
What a shock.
But I was so it's important for me on two ends to hear this information and to know that she and other first responders are safe. Not just because she's my daughter, but because I have a love for people who are literally putting their lives on the line every single day to keep us safe.
Thanks, Mom.
Okay. All right. That's it for our PSA. Take care. Bye-bye.